Hey everybody, how's everybody doing? I hope you guys were able to spend some quality time with your family on the holidays, and I hope everybody's doing okay. Hope you guys are doing great. Now, you guys notice that sometimes you have a whole bunch of to-do list for the day, right? And you're pumped up to start the day, and you tell yourself, today's gonna be today's gonna be a productive day. Today's gonna be the day. So you roll up your sleeves, right? Brew your coffee, and but then you decided maybe, you want to scroll a few posts on Facebook or Instagram or TikTok, right? And then maybe you want to check out a few funny videos on YouTube, right? And then YouTube algorithm just keeps recommending other videos. So you're kind of scrolling down those videos too. And then later on, you decided to maybe watch just one, episode of your favorite show on Netflix or Hulu, right? Or on cable, if you still have cable. And the next thing you know, it's almost time to make dinner. And you literally got nothing done or accomplished for the day. Sounds familiar? Well, in this video, I'll be giving and showing you guys a few tips that will hopefully help you conquer procrastination. So check it out. Procrastination strikes everyone, and once it gets a hold of you, it can be very difficult to shake it off. Now, when you imagine a highly productive person, you likely think of someone who focuses effortlessly on the job and never succumbs to procrastination, right? You know, the type who can sit on the ground in a subway station with their laptop and still manage to get by and have more done in an hour than you would in a day in your library, right? The truth is, ridiculously productive people face the same procrastination challenges as the rest of us. And that's a fact. The difference is they beat procrastination by using a calculated approach. That's the thing. First, they understand why they procrastinate, and then they apply strategies that beat procrastination before it takes hold. Anyone can follow this step, right? There's a few steps that I'm going to teach you guys, and it's a research driven process to overcome procrastination, okay? Now, here's what I call the procrastination doom loop. Now, you can't hope to stop procrastinating until you first have a firm understanding of why you procrastinate, right? Now, there's plenty of research, but there's this new research from DePaul University that shows that procrastination is more complicated than most people think. People tend to think of procrastination as coming from, a poor time management or even laziness, right? But the research shows that procrastination stems from negative emotions that can hijack your mood, right? And once you're under the influence of these emotions, you can't bring yourself to work. And we've literally, felt those times and experienced those days, right? You're probably experiencing it right now. All right. Now, instead of being lazy or disorganized, people usually put things off because they aren't in the right mood to complete the task. Now, doing so places you firmly inside the procrastination doom loop of, like what I said and mentioned before. Now, since you've decided that you aren't in the right mood to work, you then basically distract yourself with other tasks such as checking mail or Facebook and more Facebook and Instagram and YouTube, uh, except my channel, of course. But you clean your desk, you check the news, you know, texting, And by the time you come up for air, you feel guilty for having wasted so much time. This only worsens your mood, and as a deadline um, draws closer, you feel worse than you did when you first put off the task. So, what do we do? How do we overcome procrastination? Now, beating procrastination is a simple matter of exiting the doom procrastination loop. And it entails taking control of your mood, right? With the right strategies in place, you can take the reins and get yourself in the mood to get things done. And I'll tell you the strategies that hopefully will help you make this happen. First, you gotta figure out why. When you aren't in the mood to work, procrastination is telling you something important. It could be something simple as, you need a break or get something to eat, right? Your sugar levels are depleted. Or it could be something complex, such as, you're carrying the team on your back or you're dissatisfied with your job. Whatever it is, instead of punishing yourself for procrastinating, take a moment to reflect and figure out why you're procrastinating. Okay? This could end up being the most productive step you can take in conquering your task. Okay? First, number one, we got to remove obstacles. Now, prior to getting started on a task, take a moment to carefully consider the obstacles that might get in your way, right? Then develop a plan to ensure that they don't. For example, you might have an instruction for a task in your email or your inbox, and if you don't do anything about it, you'll repeatedly go back to your inbox to look at them, only to get distracted by the incoming emails, right, that you're getting every minute or every hour, right? In this case, your management plan should be to get the instructions out of your inbox prior to starting your work, right? Now, as you plan ahead, you can maintain your focus and avoid procrastination, okay? Because it is much harder to regain focus than it is to maintain focus, okay? Again, it's much harder to regain back the focus than it is to maintain focus, okay? Next is we need to work in the right environment. Now, even if you do everything else right, working in the right environment can make you succumb. Um, Working in the wrong environment can make you succumb to the procrastination. This means keeping yourself away from your phone, television, other electronics, right? That that can that can that can distract you at any moment in time. Now, this takes a lot of discipline, right? But you need to exercise discipline by working in the environment that's right for you. Okay. Next step would be enjoy small victories. Now, there's nothing quite like checking something off your to-do list. Okay. Now, to keep yourself from procrastinating, you need to experience this sense of accomplishment by tracking your progress carefully. Now, small victories build what we call androgen receptors in the areas of the brain that's responsible for reward and motivation. Now, the increase in androgen receptors increases the influence of testosterone, which further increases confidence and eagerness to tackle any challenges, right? Now, what this does is this keeps you fired up and moving forward. Okay? Now, remember, it's not about doing small tasks to avoid the big tasks. It's not about that. It's about including small tasks in your daily checklist to build your confidence and momentum. And the key word here is momentum, guys. Momentum. Now, lastly, don't be a perfectionist. Now, most people, right, such as writers, they spend countless hours brainstorming characters and plots, and they even write page after page that they know they'll never include in their projects or in their book. Or even me, things that sometimes it could take hours to days just to plan a video out. Now, a lot of people do this because they know the ideas need time to develop. But what happened is we tend to freeze up when it's time to get started because we know that our ideas aren't perfect. And what we produce might not be, any good. But guys, ask yourself, how can you ever produce something great if you don't get started and give your ideas to evolve, right? So whatever ideas you have, do not be a perfectionist, okay? Now, I don't want to keep rambling on and on and on, so I'm just going to cut it short. And we're now going to start with our NCLEX review. So today we're just going to go straight to the point with endocarditis, right? What's endocarditis? It's basically an infection of the endocardium, which, as we all know, is the inner lining of your heart chambers, right? And the heart valves. Okay, now, endocarditis can actually be bacterial or fungal infection, okay? And usually it can be fatal if left untreated, but with proper treatment, most of our clients will recover, okay? The problem with, I'm sorry guys, the problem with endocarditis is that infective endocarditis can cause severe valvular damage, which can eventually lead to insufficiency and heart failure, which is really bad, so we don't want that, okay? Now, what are the possible causes? Now, the main possible causes are staphylococci, which is Staphylococcus aureus, and also streptococci, which is Streptococcus viridian. Okay? Now, looking at the assessment, how do we assess our patients? Aside from the usual fevers, fever, chills, and fatigue, the patient can also have uncommon symptoms, right? Uncommon in other diseases such as rot spots, right? And rot spots is basically when you see white centers on the retina of our patient, and those white centers are actually hemorrhagic areas, okay? Another one is osternodes, which is basically just tender raised lesions that can be found on the finger or on the toes, okay? And lastly is valvular insufficiency with our patient's heart valves, okay? Now, diagnostics. How do we evaluate the diagnosis for the patient? Usually, echocardiography can reveal a valvular damage, and usually the EKG can also show some arrhythmias, right? But the main diagnostic would be blood cultures. Now, there's actually 3 blood cultures taken at 1-hour intervals that is done in order to enable us to identify the actual causative organism that is causing the patient's endocarditis, okay? Now, in regards to treatment, bed rest is important, also sufficient fluid intake, and also in severe cases of valvular damage, we do need surgery in order to replace the defective valve, okay? Now, with drug therapy, we can give our patient antibiotics, which obviously would depend on the infective organism, right? We can also give antipyretic, such as aspirin, and anticoagulant. And usually with a patient with endocarditis, the main anticoagulant that is used is heparin, okay? Now, what I want you guys to really take note is that you need to watch for signs and symptoms of embolization. Now, embolization, as we all know, is just formation of embolus that might lodge into the bloodstream of the patient, right? So we need to watch signs and symptoms of embolization, such as hematuria, pleuritic chest pain, left and upper quadrant pain, right? Because embolization can actually be a common occurrence during the first 3 months of the treatment, okay? And these signs and symptoms can indicate an impending peripheral vascular occlusion or a pulmonary infarction, which can be bad for a patient, okay? So again, this is it for now, guys. I just want to keep it short, sweet, and straight to the point. I hope you guys are doing great on your review. I wish you guys the best. Thank you so much for your time. I really do appreciate it. Thank you so much, guys. God bless. Thank you. Bye-bye. I just want to make these reviews short and sweet and straight to the point so that, you can really take in the main points and really focus on what is important. So today we'll be talking about synthroid or synthetic
levothyroxine, which is basically a thyroid hormone therapy, right, that we give to patients with hypothyroidism, right? And as we all know, hypothyroidism is a condition in which there's an inadequate amount of circulating thyroid hormones, specifically the T3 and T4, right? T3 being tridothyronine and T4 being thyroxine, right? And basically this causes the decrease in the metabolic rate in the body, okay? Now, what we need to take note with Synthroid is that we do have to monitor the patient's cardiac system, because there's a significant cardiovascular disease that accompanies with a patient with hypothyroidism. And when we are giving thyroid hormone therapy, there's the client is at risk for cardiac complications if the metabolic rate is increased too quickly, right? Therefore, we do have to monitor the patient's cardiac system for cardiovascular compromise, okay? And we can see these symptoms such as manifesting as palpitations, maybe chest pain, shortness of breath, and obviously tachycardia and a rapid heart rate, okay? Again, I'm sorry, that's my daughter in the background. Also, with this medication, treatment begins slowly, and the dosage is increased every 2 to 3 weeks until obviously the desired response is obtained. And the treatment is also considered a lifelong treatment, okay? And obviously we're going to have an ongoing medical assessment of the thyroid function of the body. Now, also, I do want to point out that with clients receiving thyroid replacement therapy, they do need to be monitored for signs and symptoms of hyperthyroidism, right? Which can occur with over-medication. Now, these symptoms that I have here is actually symptoms for hypothyroidism, which, as we all know, weakness, fatigue, and weight gain. But like I mentioned before, we do have to monitor the patient for hyperthyroidism once we're giving the thyroid hormone therapy. And the signs and symptoms for hyperthyroidism is irritability, tremors, and tachycardia, and usually palpitations, okay? So again, guys, this medication is very important in the NCLEX exam. You do have to take note and be aware the important interventions, nursing interventions that we do have to know about for Synthroid, okay? Again, this is it for now, guys. I just want to make it short and sweet and straight to the point. I hope everybody's doing well. I will be making more and more videos from now on. It's just because life has just been very busy lately. Again, thank you so much, guys. I really, really, really do appreciate your time. Thank you so much for everything. God bless. Thank you. Bye-bye.